mahal. Okay. Hi, Dr. Harvey Uy here on the Lensar laser system.
Okay.
Congratulations on your award.
Thank you. So good afternoon, everyone, and it's my pleasure to be here to talk about this technology. I want to say that we received a research grant from Lensar, and believe it or not, femtosecond laser-assisted cataract surgery has been around for more than a decade, and the technology keeps on improving to improve both the patient and surgeon experience. And unlike the capsulase, for example, which just does anterior capsulotomy, this technology will also soften your lens, create your corneal incisions, make arcuate incisions to decrease your astigmatism, as well as guide toric IOL placements. And with this new machine called the Lensar Ally system, there are some additional advantages compared to the older system. First of all, you have a more secure and easier docking of the patients. There are now multiple cameras that scan the anterior segment so that you're able to reconstruct the anterior segment anatomy more quickly. The software and hardware are better, so you can calculate the treatment plan more quickly, and the laser fires more quickly, so you can get everything done basically a lot more quickly. And amazingly, they're able to pack these additional features into a smaller footprint, so it occupies less space in the OR and gives you maximal flexibility with patient positioning. So if you have a small OR, this is of great advantage. And over the next few minutes, we'll be talking about our early clinical outcomes using this new Lensar Ally system. So this is a single-center study done at the Peregrine Eye and Laser Institute in the Philippines. We had 4 surgeons doing the surgeries. All patients received an Alcon SA60 lens, and we enrolled 67 eyes. They're really standard inclusion and exclusion criteria for a cataract study. Patients were followed up day 1, week 2, and week 6. So uniformly, all of the surgeons agree that the new Ally system greatly enhances your ability to dock the patient with ease. It's only a few patients, particularly if they have very small eyes, where there might be some difficulty docking these patients. But none of these patients experience blackout during the docking, and everybody loves the new system because it's just easier. The corneal incisions are also much better, and we find that in many cases we don't need any additional instruments. We can open up those side ports and clear corneal incisions, sometimes with just the cannula of your OVD, sometimes with a Sinski instrument. Of course, all of the capsules are free-floating, and we successfully completed the laser procedure in all patients. In the Philippines, cataracts tend to be a little bit harder than in the West, so the mean nucleus grading in this group of patients was 3.4. But you can see on the other end, we actually had patients with black cataracts. And in our practice, basically, we do these flax procedures in 2 groups: patients who want just the best of everything, and patients who are just the worst of everything. Complicated cataract surgeries where we find that the laser helps us do the surgery more easily. In this group, the overall effective phaco time was 10.9, which is pretty decent. Visual outcomes were amazing. The mean corrected distance visual acuity was 0.06. This is 20/20 basically. And all of the patients had at least 20/40 or better corrected distance visual acuity. Again, because the laser softens the lens, you need less phaco energy and fluid to perform the surgery. So we have very few patients with corneal edema, and those who have had minimal corneal edema, the surgery is very safe, no adverse events. And we find that using this technology, we're able to shorten our cycle time by about 9 minutes. So because you're able to do the surgery more quickly, you can put more patients in the operating room, and that makes you more productive. So again, with the new Lensar Ally system, the advantages are better suction, easier docking, shorter imaging time, and faster laser speed. You virtually don't have to use your knives anymore. It's very rare that you're going to need knives. Very consistent in creating the capsulotomy. And because of all of these advantages, the post-operative visual outcomes and corneal edema are generally better than you would expect if you do conventional surgery. So we find that this LENSAR ally system effectively and safely facilitates cataract surgery while improving workflow time and efficiency. Thank you very much for your kind attention.
Very nice. So it's a combined phaco with femto, combined, not yet.
It's not yet. You can just do the laser part, but there are plans to
Integrate.
combine it with the cataract surgery. So that'll even save you more time.
More time, yes.